Chapter 13, Part 4, Blood Supply to the Brain. So, maybe you're sitting studying for a couple of hours, maybe you're writing a paper, you're thinking a lot, and you may notice that you get the munchies, you get really hungry, you've studied for a few hours, and you get up and you're like, oh my gosh, my stomach must have eaten my liver. And I'm always kind of, even though I know the physiology behind it, it's always kind of like, well, I haven't even done anything, but I really have. I'm sitting in front of the computer, I'm thinking, I'm working things out, I'm navigating a course or whatever, and that takes a lot of energy. Our brain has a high metabolic rate, so it needs a constant supply of oxygen and glucose. And how does that get to the brain? But through the blood. So because of that, the brain requires a lot of blood. 15 to 20% of the blood pumped by the heart is to the brain. And obviously, common sense says interruption of blood to the brain can cause unconsciousness and irreversible brain damage. So the brain receives blood through arteries, specifically the internal carotids and the vertebral arteries. The vertebral arteries join to form the basilar artery. The carotids join the basilar to form the cerebral arterial circle, also known as the circle of Willis. And so the circle of Willis are the main blood supply to the brain itself. And the circle of Willis is basically kind of the way it is, I don't want to say designed, but the way it is anatomically situated underneath the base of the brain. It's in a kind of like a circular pattern, although if you see pictures, you're like, well, that's not a circle. I get it. But the way it's laid out is, so if one of those small arteries going to the brain is blocked, there's other options for blood supply that are coming through. It's coming from multiple different places through the circle of Willis. So, there was a kind of a fail-safe for when there is any sort of a blockage in that area. So the blood-brain barrier, which is a tongue twister. So the blood-brain barrier permeability of the blood-brain barrier is determined by, so there's a barrier that basically only certain things are going to get through to get to the brain. So certain medications cannot get through the blood-brain barrier. So if you have an infection in your brain or around your brain, medications have to be able to get to it. And so we have to consider that when treating a patient for certain things or certain medications for certain issues. So permeability of the blood-brain barrier is determined by the endothelial cells that line all the capillaries. They have super tight junctions between them, so it's hard for anything to get through there. Astrocytes, which, remember, those are one of those glial cells, those helper cells of the nervous system. They have these processes that influence capillary permeability, so they can keep things from getting through or let things through, depending on what we're looking at. And then there's also a basement membrane of the endothelium. So all of those three things are absolutely related to the permeability of the blood-brain barrier. So that might come up as a question, as what is the permeability of the blood-brain barrier determined by? And I just gave you those answers. So just some examples: lipid-soluble substances can pass through by diffusion through that blood-brain barrier, things like nicotine, ethanol, and heroin. Water-soluble substances move through by mediated transport, so they need some sort of help, some sort of access, some sort of channel, things like amino acids and glucose. An interesting note on the bottom of page 456, the last paragraph about Parkinson's disease and how permeability of the blood-brain barrier affects treatment. So it says the permeability characteristics of the blood-brain barrier are an important consideration when developing drugs to affect the central nervous system. For example, Parkinson's disease is caused by a lack of the neurotransmitter dopamine, which is normally produced by certain neurons in the brain. Lack of dopamine results in decreased muscle control and shaky movements. However, administering dopamine is not helpful because dopamine is unable to cross the blood-brain barrier. Instead, physicians will prescribe levodopa or L-dopa, a precursor to dopamine, because it will be able to cross that blood-brain barrier. The CNS neurons then convert the levodopa to dopamine, which helps to reduce the symptoms in Parkinson's disease. Interesting stuff. All right, so cranial nerves. So cranial nerves are indicated by Roman numerals from Roman numeral 1 through Roman numeral 12. There are 12 sets of cranial nerves. We also have specific names for cranial nerves, and I provided a table for you to fill out on cranial nerves, and I filled in the Roman numerals 1 through 12, and then you can fill in the name and the functions. But the cranial nerves may have one or more of three functions. They could be a sensory nerve. They could be a motor nerve, also known as somatic motor nerve, or they could be parasympathetic, which is a regulation of glands, smooth muscle, and cardiac muscle. Sometimes some of the cranial nerves can be motor and sensory, but we aren't going to really get too much into that. So here is an image of a brain, the base of the brain, and I wanted to show you this next to each other because this is a real human brain here. And you can see this is an image, it was a smaller one that I was able to stick in here so you could see all these branches of these nerves. These are all cranial nerves. They're all coming off of the cranium, the brain. And you can see here that all these branching here, and that there's little ones here kind of branching off, and you have two big ones here. So those are all your cranial nerves. You're not going to have to physically identify them, but you are going to have to know the function of each. And so this screencast is going to end fairly quickly here because I'm not going to go through every single one of the cranial nerves, but I just want to show you what you should be filling out that table with, that worksheet, the blank worksheet table that I gave you for chapter 13 on cranial nerves. So it's Roman numeral 1, olfactory. That's the name, is the olfactory, Roman numeral 1. And what is the function? It functions in the sense of smell. Okay, so the next one is the optic nerve, Roman numeral 2. It's called the optic nerve. What does it do? Sense of vision. It's associated with vision. Oculomotor, Roman numeral 3. Oculomotor is the name. So as far as the motor part of it, it moves the eye muscles. I don't care about which ones. You could say it's associated with the eye movement. Parasympathetic, sphincter of the pupil, ciliary muscle of the lens. Okay, keep it simple. You don't have to write a paragraph for each of these. Just keep it really simple. Roman numeral 4, trochlear. What does it do? It also is associated with motor movement of the eye. And then I'm going to stop here at number 5. 5 is a trigeminal. It has some sensory function for sensory information coming from the scalp and basically the part of the head. And then motor, muscles of chewing, which is mastication, as well as, I can't read this very well, the soft palate and the throat and the middle ear. So keep it as simple as you can with writing down the functions of these, because you don't have to know a book for each of them. You just have to know basics as far as the Roman numeral, the name of the cranial nerve, and then the basic functions. And there was one I wanted to, the vagus nerve. I wanted to talk about the vagus nerve. That is Roman numeral 10, called the vagus nerve. And let's see, I know there was something about this I wanted to remember. I got it now. Sorry, I'm having a moment. But the vagus nerve is the longest nerve in the body. So I think it could run up to 1 meter long, if I remember the actual length. In some people, obviously, if you're a shorter person or a very tall person, that's going to be a little different. So again, I'm not going to go through all of these. I'm going to pop to the end here, which is going to talk a little bit more about the vagus nerve. So the vagus nerve is associated with reflexes related with heart rate, blood pressure, and respiration. Reflexes involving both cranial nerves and the brainstem. So the vagus nerve, turning the eyes toward a sudden noise, if you're startled, a touch on the skin, a flash of light, eyes tracking a moving object, and so on. So the vagus nerve is kind of involved in a bunch of different things. So you can use this to fill in number 10, the vagus nerve, instead of everything that's on the chart, or on the thing here, on the tables that are provided in this PowerPoint. So that is the end of chapter 13. So we're going to pick up on chapter 14 next.